I'd like to welcome you, Dr. Deborah Banker, to Truth from the Source. Thank you for joining us today. And so, Deborah, your work has gone into the holistic area and preventative eye care.
I am an ophthalmologist, and I have the same training as an ophthalmologist and learned to be an eye surgeon. But a couple of things. First of all, and Western medicine has done a great deal to help people in areas of glaucoma and cataract surgery and benefit a lot of people. But there's a lot of people that even if they have everything that's done in Western medicine, they still go blind. And I felt there's got to be answers in this. And when I finished my ophthalmology training, I actually started studying Oriental medicine and herbs and acupuncture, acupressure, etc., philosophy. But also, I had a lot of problems with my own eyes. They dried out, had difficulty focusing, and I actually had to hire people through college and my medical school and residency to help me read. I did not have the capacity to read as much as normal people. I mean, it was to the point where I was totally light sensitive. My eyes were drying out, and if I read more than a half an hour, it felt like someone had thrown acid into my eyes. So that was quite serious, and the only way I was able to get through all of my training was to have much of the material read into tapes, and then I would listen to them into the wee hours of the morning. I mean, I still was reading, huge amounts. Sometimes I would be reading, 10 to 16 hours a day. But when my eyes would hit that tired point, it would be gone for weeks. So yes. I had to really prepare myself for that being a potential. And then when it would come time to study for the finals, where most people are really cramming at that time, I couldn't. My eyes would not do it, and it's hard for people to understand this. But if you've ever been very depleted from an illness, and maybe you've had pneumonia or something, and you'd love to get out and go running, but you can't because you just don't have the energy.
Yes.
Well, the same type of thing happens to the eyes. And also, there's a lot of people out there who suffer from eye dryness, so they don't understand. And because of the alternative medicine that I've studied, I'm sure that it's made me more sympathetic. It's made me look in other areas. Luckily, I was able to find some people in my youth who were able to start me on some eye exercises. And I have done a huge amount of studying in them myself, and I've actually put a kit together with books, tapes, and videos, and reviewed about 40 different books from all over the world, different philosophies, different cultures that I have condensed. And I give classes, and I teach people individually. And I also have invented machines which put energy into the body, into the eyes, which help to heal many forms of blindness. They've brought people out of comas. They reset the autonomic nervous system. When I studied Oriental medicine, for example, and you learn about acupuncture, you begin to realize that there's this whole system called Meridians, and they're energy ley lines, and the energy does run up and down them, and they go through organs, and then you begin to realize how these ley lines connect one organ from another. So you could have problems with your stomach, and it can be affecting your eyes through these meridians.
And the liver also.
The liver, the kidney, actually just about every organ can have some effect on the eye. They're extremely sensitive in your circulation, your respiration, your nutrition, because the eyes really are probably one of the most delicate barometers of the entire body. And that is part of the problem with ophthalmology. We tend to isolate our focus on the eyes itself and kind of forget about what's happening in the rest of the body, or we leave that simply to the internist. Now, it's not that I want to become your internist, but there are things that I would suggest, and things, for example, it always amazes me how many people who have poor circulation in the back of the eye, and they're still on coffee, they're still drinking alcohol, they're still smoking cigarettes. This is just basic common sense.
But it seems that you're treating the whole body as, understanding the eyes has led you into the whole body, which as one unit. I was
a general practitioner before. I was an ophthalmologist. I've birthed babies. I've just done straight Western medicine as a general practitioner. But I always would not only give them the medication, but I also would give them things to do. Like if a child was sick with a cold, I'd say, take them off of milk-forming mucus type stuff, put them on, vitamin C, and start steaming them. Just your basic, sensible. I call it mommy medicine, but that's part of the work.
Right, absolutely. So, how do you feel about iridology?
First of all, I'm not a trained iridologist. So I hate to make an opinion about what I'm not trained in. I have taken the charts. I've put them up. I do not see a direct correlation, but I've also not taken courses in it. So I do not try to put an opinion in for something. It's like for me to make a decision about what Oriental medicine is or is not if I've not trained in it.
But you've not seen a correlation between...
Not a good one, no. But then I didn't spend, months and months. And for me, if I find something that I see something straight away, like I have with herbs, I have with acupuncture, I have with electromagnetic fields, I can see an improvement or a correlation within a very short period of time, and I see that it's helpful and not harmful. But I have not seen that. And you see, I have a slit lamp. I can magnify the eye. I can magnify this. So, I have opinions about it, but this is not what I do, so I really don't wish to discuss it.
So what can be done to improve near and farsightedness?
Okay, an awful lot. First of all, nearsightedness is when the muscles that surround the outside of the eye are kind of tightening around the center of the eye and like a band and elongating it, thinking of a balloon and putting a string around the middle of it and tightening it, and it becomes elongated, and that is what nearsightedness is. Whereas farsightedness, the eye is too short, in my opinion, is basically because mainly the rectus muscles in the back of the eye, they are all kind of tightening together and shortening the back of the eye. They come from the back and attach above, below, medial, and laterally, and there's fat in between them. So when they contract together, they push the back forward. And there's 6 muscles on the outside of the eye, and there's one sphincter-like focusing muscle inside the eye. Now, the muscle inside the eye focuses very quickly for distance and near. The muscles on the outside of the eye, we usually think of them as looking up, down, etc. We don't think of them as focusing, but they do. They can hold tension, but the focusing that they do is very, very long and very slow and insidious. It usually doesn't change rapidly, okay? It's just like the tension in your shoulders. When you get tension in shoulders, it doesn't happen overnight. It happens over a very long period of time. And then if you put hot packs, massage, acupuncture, you can get rid of it. But you have to do some type of stretching exercises. So we have to change our concept about how the eye works. And people go, oh, well, the eye can't change. And I go, yes, it can. It's like a balloon filled full of fluid. It's got 6 muscles on the outside, 1 muscle on the inside, and it's in constant dynamic change. Now, I'm going to give you some basic exercises of people so they can begin to understand some very simple things. Think of the muscles around the outside of the eye as going into a spasm. And because of this spasm, it is changing the shape of the eye. Now, when you wear glasses, it does help you to focus. But what happens is you stop using your eyes and having them going in the long up, down, medial, and lateral, but rather you turn your head so you can keep your eye in the very center of your lenses. And matter of fact, it's even worse with progressive bifocals because now you have a small, thin corridor in the very center of your glasses that you can read with, and it's the head that does the moving and not the eye that does the moving. And so what my work does is, one of the exercises that I'm going to teach you is about getting those muscles to unspasm. And so a very simple one that people can do is called tracing your environment. And where the wall and ceiling come together, any pipes on the ceiling lines and the ceiling lines on the floor, designs, walls, trees, clouds in the sky, outside of buildings. And you need to be constantly moving your eyes in very long, slow swings. Now, there are specific patterns that you can use. The same muscles can be tightened or loosened. If you have specifically you're nearsighted, you can make your eyes swing in an almond shape as if the almond were on a horizontal plane, because you have a muscle over the top called the superior oblique and a muscle underneath the eye that is called the inferior oblique, and so they kind of sling the eye. They're attached someplace near the nose and they go laterally toward the ear, so you have that above and below. And so this very long, slow swing above the top of the horizontal almond, and very long, slow swing below on the bottom side of the almond, slowly starts lengthening these what are called oblique muscles, the superior and inferior oblique. Now, if you do this fast, you will tighten them up. If you do it slow, you will loosen them. So if you do it slowly, you will help nearsighted nearsightedness. If you do it fast, you will help farsightedness. Okay, so the muscle, that's one of the interesting things. See, a lot of the books just think, well, all you have to do is relax. And, a lot of people have heard about Bates, the Bates technique. Well, remember, Bates was doing his work, 1912, 1920, all the rest of that. He didn't have access to Oriental medicine and acupuncture and nutrition. I have a great deal of respect for him, the time and the knowledge he had, and he made a stand and said, we're overcorrecting people, and these glasses may be accelerating the deterioration. And I feel that to be true. But we do, many times, we may need glasses to see to drive, but we don't necessarily need to be corrected to 20/10. If we were corrected to 25, we would be able to see just fine. We'd be safe to drive both day and night. And then we could start on some eye exercises and slowly get better.
So a lot of ophthalmologists are over prescribing their lenses, and then the eye gets weaker because of it. It doesn't have to work very hard. Yes,
because now, see, the muscles are constantly adjusting themselves. But if you have put in all the correction, it not only won't allow the muscles, to work. It actually stops them from even attempting to try. Now, I'm not saying take your glasses and throw them away, because that would make many people would be dangerous on the road, for example. What I am saying is that there is a way that the doctor can work with the patient and slowly reduce the correction and start them on an eye exercise program, and that's what my Vision Improvement Kit's all about, how you work your way through it. And, for example, I have a lady that I've been working with. I started with her about 3 months ago, and she was in a minus 11 diopter correction. Now, that type of person, when they take their glasses off, can only see probably about an inch or two away from their eye clearly. Otherwise, everything is blurry. And we've been able to drop her down in 3 months to a minus 5. Which now, that still is a high correction, but normally that would have taken about 2 years for most people to do it. She's done it in 3 months, and she's still getting better and better and better, and she's just amazed at what's happened. But she had other things, too. She had headaches, she had stomach aches, and we were getting rid of the headaches, the migraines, the stomach aches. These are all because when she would get stressed out, she'd get the stomach aches, she'd get the migraines, her muscles around her eyes would tighten up. This is not just one problem. This is multiple problems of how the body deals with tension.
And so we don't even think about the eye generally, because we've just never been taught that we know the eye has muscles, but we don't think about exercising them so much.
Right. Well, it's just not, there are whole philosophies in China, for example, where they will have the factory workers and the children stop twice a day and do 10 minutes of acupressure point exercises, so they understand that.
Excellent.
And in the regions that they do that, people do not wear thick glasses. Now, if you take someone who is Chinese and bring them over here and they live our lifestyle, eat our food, and don't have the training, of course they're going to get thick glasses just like we do. So it's not you are genetically inferior. If that were the case, then the whole American public is genetically inferior to the rest of the world, because we wear more glasses and have more eye problems than the rest of the world.
Do you think there's laziness has a lot to do with the eye problem? Because, if people knew about the exercises, but they don't do them, what good, they've got to really be dedicated.
There's a certain amount of laziness, but it's more that they're just not educated because their doctors are not taught this information. If you go to your doctor, and we have the philosophy that our doctor is trained, he's got the degrees, he must know all the information, and if you go to your doctor and the doctor says, no, this is impossible, then where do you go? And they'll go, well, anybody who doesn't have a degree and is teaching this is a quack. Well, I think that what they need to understand is there's an invested interest in keeping people in the old ways. People are afraid, well, if all my patients got better and didn't need glasses, who am I going to treat? When the fact of the matter is you're going to treat the rest of their family.
Right.
And maybe we're going to stop blindness, and there's always going to be something new. There's always going to be more information. I have never found that because someone has gotten better and doesn't need my services anymore. Just what happens is my reputation gets larger and more people come to me.
Right. There's no fear there.
But you do not make the type of money that if you were a surgeon. You just don't. But to me, the truth is more important. I don't want to have these eye problems. I don't want to go blind. People do not go blind from old age. They go blind because of poor circulation, poor nutrition, and the muscles tightening up and distorting the shape of the eye, and causing the retina to stretch and to deteriorate, and retinal detachments because of continued deterioration from the stretching of the retina.
When you think about a muscle like your arm, when you've been using the computer constantly, it gets a sore point where the muscle just hurts, and the eyes are constantly, if you're doing the same, a job in and day out, the same thing.
We need to take frequent visual breaks. That's for one.
Yes.
We were never meant to spend our whole life
in front of a computer.
In front of a computer or reading or doing close work. We were meant to be a species that got up often to run and exercise and do physical, activity. And so some of the recommendations that I tell people is get when you're reading something, look up at the end of every paragraph. And I would say if you're on the computer, look up twice every paragraph in the middle, and then I guess of the typing and et cetera.
Yes.
Get up and do something every 20 to 30 minutes.
Yes. And take a little break.
Put yourself in good lighting conditions with natural lighting coming in, or make sure that you have full spectrum lighting, not fluorescent lights above you, because you're getting radiation off the computer. If you can work with a laptop, apparently there's less radiation. They also now have shields that you can put up in front of computers that are helpful. Antioxidants are very important. The radiation from the computer actually causes the red blood cells to stick together. So vitamin C, vitamin E, vitamin A. Coffee's not great if you're going to be in front of a computer, because again, the radiation from the computer decreases your circulation to your eye. So all of these things, it's about. I'm not saying that don't use your computer. We all have become a computer world. But if you start using some of the things that I suggest, you'll find that your eyes won't. Watch your food as you eat. And you'll say, well, I do that. No, you don't.
Watch it as it comes into your mouth?
Yeah. As soon as it starts getting blurry or difficult to focus on, everybody looks away from it. I want you to watch your food or your drink or whatever it is with 3 bites or 3 drinks with every time you pick something up. I don't care if it's a snack or, a meal, and only 3 because I don't want you, I want you to eat and enjoy it. But you're going to have to put some conscious effort following it all the way in and following all the way out. Okay? There's another one that we do, which is a thumb push-up. Take your thumb, put it straight out in front of you. Look at the wrinkles on your thumb. Take some long, slow, deep breaths, clear it, and then slowly bring it towards you. When the wrinkles become blurry, stop and take long, slow, deep breaths. And when it clears, bring it an inch closer and more long, slow, deep breaths. Every time it clears, and the closer you get, the longer it'll take. Long, slow, deep breaths are very important. And bring it another inch closer. Keep on doing this until you get to a point where it will clear no more. Then take the thumb and stretch it out and look off to the distance. So, and then a last thing to do, like when you wake up in the morning, for example, a lot of people like to, read a little bit when they just woke up. And they don't want the world to know that they're up yet. Well, start, with the book if you have to, at an arm's length or wherever you have to, bring it into where your focusing point is. But bring it right to the point where it just barely gets to be blurry. And start reading there until it clears, and then bring it in another inch and read. And by the time you've been doing this for half an hour, for example, very slowly, you found that you've probably brought it in a foot closer.
Wow, amazing. What about when the headache starts?
Where do you get the headache?
When the thumb comes in to a point where
you don't do it for very long periods of time. Yeah, that's why using the book is very good, because you can start and do it on a much slower, bring it in slowly. So, you don't do it for a long period of time, and you don't overdo it if you start getting a headache. But, as you do it, each time you're going to get stronger and stronger and stronger, And if you want to push it, but not so much that you're uncomfortable, but it will be a little bit uncomfortable, just like doing sit-ups is a little bit uncomfortable, but not so much that you get a Charlie horse.
Right. How can excessive nearsightedness contribute to a detached retina?
Well, that problem is that when people are highly nearsighted and the muscles, the obliques, are pushing on the eye, it causes the eye to stretch out, and the retina itself is not very flexible. And think of the back of the eye as kind of being a cup, and the retina coming forward, and it comes forward to about the level of where the iris is. And there's a strip right behind the iris of a couple millimeters, which we call the ora serrata. And it's an area where the circulation's not very good. And so that's where the retina is coming forth and kind of attaching behind the iris, and that's a place where a lot of thinning can come at the retina and actually retinal detachments. And so the more nearsighted that you are, the more pull there's going to be on this space. Does that make sense?
Mm-hmm. Mm-hmm. Yeah.
So when you go to the doctor and year after year after year after year, he gives you stronger and stronger and stronger glasses, there is a stretching and a distortion and a lengthening, almost like, when you've seen an old balloon and there's areas where you see kind of warping. Well, the tissues will stretch out. Now, they can stretch out also if your metabolism isn't very good, in particular your liver. In Oriental medicine, they say the liver rules the kidney. The liver rules the tendons. The liver rules the tendons. Uh-huh. So to me, the sclera is a tendon-like material, and when a highly nearsighted person, their tendons are very thin, and their scleras are more easily distorted. The tendons are very weak, rather. It's a better expression.
Uh-huh.
And so that same type of person, who's highly nearsighted, if they went out for sports, for example, football or something, the same injury to them probably would be worse. There's even been reports of people who are highly nearsighted who went on some of these high-speed amusement rides and have come up with retinal detachments. I had a patient of mine who was highly nearsighted, and he was swimming in the ocean in the Caribbean, and a big wave came over him. When he came up, he had bilateral retinal detachment.
Oh, boy.
So, a hole could be sitting there, and we could go into, extreme sports of some type.
Mm-hmm.
And so, yes, there is a difference, and doctors don't realize that this is the consequence, that they may actually be feeding the mechanism rather than, it's not, again, that we don't need glasses. It's not that there isn't a problem. It's that the glasses are just a part of the training. We put them in glasses so that they won't be dangerous when they're driving on the road, so they can do their work, so they can do their reading in school. But then we start them on an exercise program to start opening up the muscle spasms. And with the work that I do, and I can look at their prescription, I can tell which muscles are too tight or too loose, and we can actually tighten them or loosen them with acupressure points. And I can teach this to patients. I can teach this to doctors. And that it will give you can actually go in through acupressure points and tighten and loosen muscles. And matter of fact, we were discussing how I was teaching someone we mutually know
mm-hmm.
just yesterday.
Mm-hmm.
This person, by working with the acupressure points and massaging on them, went from 2040 down to a 2015, which 2015 is better than 2020, and she would have been put in some fairly strong first step glasses, and even in just one session, we were able to reduce the tension on the muscles around the eye enough so that's not going to happen.
And so how often, I know you really should be doing this every day, does it ever come to a point where your eye is okay and you don't have to do the exercises?
Well, yes and no, okay? Is there ever a point where you don't have to take care of your body and be physically fit?
Not really.
Okay, but when you get in better shape, you don't have to do so much, right?
Yes.
And so as far as, for example, even someone who does not have reading problems yet should start the eye exercises, the thumb push-ups and stuff, so that they don't have to have them. And, once you've gotten it, you may have to be aware of it and work on it for the rest of your life. Now, that may mean that, your vision isn't as good as you were when you were 15, and you may need a flashlight in the car, or to see the map, or a small flashlight to read the menu. But that doesn't mean you have to have reading glasses dangling around your neck all day long. You know what I mean?
Mm-hmm.
So that sometimes, yes, but you probably had some difficulty reading that map when you were in your 30s.
Yes.
But now things are a little bit worse, and a small pen light, for example, carrying that along, you just with that extra light, you a lot of times can see what you need. Sometimes you do have to wear some reading glasses, and if that's the case, get the smallest prescription you possibly can. The prescription is usually on the temple, and then start yourself on an exercise program. And like I said, I have a very good one. There are others out there, but of course I think mine's the best.
What about herbs? Do you think eyebright or other types of herbs are good?
Yeah, eyebright is a good herb. It takes congestion out of the eyes. There have been some reported cases where it's helped cataracts. Things like vitamin C, vitamin E, and vitamin A are very good for cataracts. There's something called Succinnaria maritima, which does. Lutein is very good for the back of the eye. Something called both vitamin C and hyaluronic acid is very good for floaters and vitreous problems. So yes, there's a lot of things out there, and we're learning more and more about that. The old wives' tale about carrots and spinach are good for you. Most definitely, carrots are high in vitamin A, and spinach is high in lutein, which is good for the back of the eye.
Mm-hmm. Yeah. Excellent. And could you tell me what diopters and astigmatism is?
Well, diopters is a hard thing to understand. It really has to do with how strong the lenses are, and you've got to see, the whole point of the lens is to bend the light, and the reason we do that is because the eye is too long or too short for the rays of light. A nearsighted eye, the rays of light are focusing in front of the eye, and so we would need to put a lens up that actually will lengthen the focusing mechanism, so it will hit the back of the retina when it comes together as a focus. Mm-hmm. Whereas in the far-sighted eye, the eye is too short, so we need to put a lens up, a condensing lens or a plus lens that will make the rays come together very quickly, so they'll focus on the back of the eye. And so this is what the glasses are, is they're changing how fast the rays of light come forward and backwards. Mm-hmm. And so it's a little bit hard to understand, but someone, for example, who was was nearsighted and took their glasses off, if they had a 2 diopter correction, they'd be able to see about a half a meter or 1 divided by 2 away from themselves clearly. If they were in a 10 diopter correction, they'd only be able to see a tenth of a meter away from themselves clearly without their glasses on. So it really is about how strong the glasses are, how fast they change the angle of the rays of light coming together for a focus. Okay, mm-hmm. And astigmatism is that the muscle is too tight in one meridian. Okay, you have a spherical correction, which is the same correction in all directions, or a astigmatism, which means one muscle or 2 muscles are tighter and causing more pressure in one direction, making the eye look more like a football instead of a basketball. Mm-hmm. But these are basically muscles, and with the acupressure points, if I can look at the prescription, I can usually tell where the astigmatism is and correct that. And I, again, can advise people individually. You can't say anything flat because it could be in any direction of 360 degrees because the eye is circular, right?
Yes.
So once we find out what direction it is, the axis, if there anybody understand this ophthalmological language, you look at your prescription. If the prescription is written in the astigmatism part is written in a minus direction, there'll also be an axis. Well, it's not in that axis. It's 90 degrees away from it. But if it's written in a plus correction, it's in the same direction. And that doesn't make an awful lot of sense, but it's what I call medical-ese, and I could explain it to an eye doctor or a patient. Could I leave a telephone number for people to contact me?
Oh, I was going to ask you. Yeah, I was going to ask you about your workshops and your seminars and stuff.
Okay. Actually, we're just happy to have a workshop this weekend. We'll have about 20 people coming here.
Oh, in Malibu.
In Malibu, and we'll be having one in October and another one in December if you have anybody who's going to be here.
Okay.
I did give one, actually, I think it was in April in Kauai. I was there. But anyhow, people can contact us about these, or if they can't come to us individually, we have put together packages with books, tapes, and videos so they can learn on their own. Uh-huh. And So
and it's an excellent package, by the way, and I thank you for mine because it's wonderful.
You're looking at it. And anyhow, it's a step-by-step program, and our phone number here is 310-317-2119. Again, that's 310-317-2119. And our website is www.drbanker.com. And we also that again, that's drbanker.com. And we also have a newsletter that we put out with new exciting things that we find out.
That's wonderful. Thank you so much, Deborah, for your time and the information and education about our eyes. Mm-hmm. It's been wonderful. And again, your number is 310-317-2119.
Right. Uh-huh.
Okay.
Great.
Thank you.